And joining in studio now is Anthony Cataldo. He is the CEO of Genesis Biopharma Incorporated. GNBP is their stock symbol. Tony, good to see you again.
Yeah, likewise. Glad to be here again.
Now, we had a great interview last week. We didn't cover as much ground as we'd like to. I know we have a lot to talk about this week, but why don't you tell us again what the company's all about?
Well, just to refresh people who were here last time and those who haven't been. What our company does is we're a biotech company, just like many biotech companies. But we're an execution story. Most biotech companies are drug discovery, and that's a long process, and there's hundreds and hundreds of millions of dollars that go into that process before you get to where we're at. We're now what I would call an execution story. We have a stage 4 melanoma treatment that is currently the standard of therapy in some of the major cancer hospitals in the United States. MD Anderson in Houston, F. Lee Moffitt in Tampa Bay, the National Cancer Institute, which is actually Dr. Steven Rosenberg, who is the inventor of the technology. He's chief of surgery there. And Sheba Hospital in Israel. And I saved Sheba for later because you're going to tell us about a little video that you're going to air on our behalf for that. And so that therapy has gone a long way. We're now at the latter stage as a biotech company where our next trial will be an actual licensing trial from the FDA.
Now, you mentioned a video. I think this is an opportune time to look at that right now. It really explains the technology. It's quite uplifting. Let's look at that right now.
Thank you.
Danny is an Israeli composer and radio announcer. He's alive today thanks to the TIL treatment. A few years ago, he had metastatic melanoma, which spread to his lungs. Chemotherapy and all other existent treatments didn't help.
The way the situation, my melanoma was spread over my body, it was very dangerous. I mean, very dangerous. I was dying.
Shmuel is the director of a successful mall in a city in Israel. He has a warm family and many plans for the future. A few years ago, he discovered he had metastatic melanoma. Shmuel went through years of operations and different types of chemo, but nothing helped.
Then I saw the doctor who said to me, "Shmuel, there's nothing we can do. The chemo's not working. Other materials aren't helping. That's it. Medicine can't help." So then I asked him if this was the verdict because it was a death sentence. His reply was, "Statistically, in your condition, you have 10 months to live."
After all the usual treatments of metastatic melanoma failed, Professor Jacob Schachter of the Ella Institute at the Sheba Medical Center suggested that Shmuel and Danny join an innovative clinical trial. This was the TIL treatment. Immunotherapy, which uses tumor-infiltrating lymphocytes, is designed for patients at an advanced stage of metastatic melanoma. T lymphocytes are white blood cells whose job it is to fight the tumor. However, due to a system failure in patients with metastatic melanoma, they are not sufficiently active, although they do exist at the site of the malignancy. TIL treatment activates those TIL cells to fight the malignant tumor.
We usually receive tumor tissue after surgery from our patients, and from this tumor tissue we isolate the cells, the tumor-infiltrating lymphocytes. We start usually with a very small amount and expand them in the end within a month to a huge amount. We get to about 5 or 50 billion cells, even more.
On the day of treatment, the patient receives billions of his own activated TIL cells through an IV, combined with material which boosts the patient's own immune system to start fighting against the melanoma cells.
Usually within 4 weeks, we see the beginning of the clinical response. In the CT scans, we see the metastases are getting smaller and smaller, and some of the metastases finally disappear. And if you achieve a complete response, it's durable, and you actually cure patients with advanced melanoma.
Danny went back to his work and daily routine. He doesn't take any pills and doesn't need treatments, just a checkup every 6 months.
That saved my life. I mean, I believe that saved my life. I mean, without the treatment, I wouldn't be here.
Shmuel doesn't have any evidence of the disease, doesn't take any pills, and doesn't need any more treatments, just an annual checkup.
After 1 month, I went for my first CT, and then Professor Schechter told me that the tumors seemed to be a bit smaller. 3 months later, I did another CT, and the tumors had shrunk again. I came back to life, went back to work, and to do the same things I did before.
Dozens of patients from Israel and Europe have been treated with success at the Ella Institute for Research and Treatment of Melanoma at the Sheba Medical Center. For many patients, melanoma can be cured. Make sure to ask your doctor about it.
Well, we're back, Tony, and my gosh, that is really powerful, just really enlightening to see that. Now, where is the company right now with respect to your FDA approval?
Well, we actually just had, on August 23rd, we had our what's called a pre-IND meeting with the FDA, and the results of that meeting were fabulous from our perspective. The way the FDA works, and we're a public company, know about that stuff, but the FDA is just another layer of transparency and sometimes no transparency. And by that I mean you're really not allowed. We did get our minutes back. We did report last week that we had our FDA minutes, and we're very, very excited about it. But I can't really get into all the nuances that are happening. Suffice it to say that the company is now moving forward with the single trial, and that's definitely a big move for us. And when you look at the comparables where we are as a biotech company, we're a $32 million market cap company, bulletin board. Other companies like Seattle Genetics and Dendrion, when they're at the same stage that we're at, had market caps in excess of $700 million. So what we need to do is just get the message out, because we acquired the technology as the latter stage commercial representation for the NCI's technology. You know, we got all of that paid-in capital that was already invested in it, but it wasn't our paid-in capital. It was taxpayer money.
Again, Genesis Biopharma, GNBP is their stock symbol. Fascinating. Looking forward as we continue this journey with you over the next several weeks.
All right, thanks for having me on. I appreciate it.
Take care.
Sure thing.